I'm now in Frankfurt at the EBMT, and it's actually my great pleasure to speak to you and to talk to AML Global Portal. The question or the task I was asked to perform in the next couple of minutes is to provide you with some considerations on how to choose the right patient with AML for allogeneic stem cell transplantation. Of course, it's a tough job within 2 minutes, but all I can say is I think there are two things you need to consider. First, the things which lay more on the patient side, so age, comorbidities, and the clinical status, including organ function, heart function, liver tests, and so on. I think this is something which we do on a regular basis. But the other side is, what are the patients benefiting from stem cell transplantation? And I think this needs to take into consideration the disease risk. And the way we classify patients with AML at the moment is based on a so-called ELN classification. The ELN has 3 groups: a favorable and a poor risk, and a large group of patients with a so-called intermediate risk. Whereas there's common sense that the favorable patients should not undergo stem cell transplantation in first complete remission. Every patient being eligible with a poor risk classification should be considered for stem cell transplantation. And then it leaves you with the large group or cohort of patients with the intermediate risk, and I think there the decision needs to be made on an individual basis. We prefer to have these patients in clinical trials because the jury is still out which kind of patient may benefit from stem cell transplantation. So MRD has to be taken into consideration. So this is, I would say, this is not so easy and cannot be discussed within 2 minutes, but all I want to say is that the ELN classification is the backbone for treatment decisions in AML and stem cell transplantation.